Stress is a part of everyday life, but when it becomes overwhelming, it can affect our bodies in ways we might not expect. One question many people ask is whether stress can actually delay a menstrual period. The answer is yes. Stress can indeed have a significant impact on the menstrual cycle. But to understand how, we need to explore what's happening inside the body and how stress interacts with the delicate balance of hormones that regulate menstruation. The menstrual cycle is orchestrated by a complex interplay of hormones, primarily produced by the hypothalamus, pituitary gland, and ovaries. Think of the hypothalamus as the command center in the brain. It sends signals to the pituitary gland, which then communicates with the ovaries to regulate the release of eggs and the production of hormones like estrogen and progesterone. When everything is running smoothly, this cycle repeats itself roughly every 28 days. But when stress enters the picture, it can disrupt this carefully synchronized process. Stress triggers the body's fight or flight response, which is controlled by the hypothalamus. In times of stress, the hypothalamus prompts the adrenal glands to release stress hormones, such as cortisol and adrenaline. These hormones are incredibly useful in short bursts. They help you react quickly to danger or challenging situations. However, when stress becomes chronic, and cortisol levels remain elevated for extended periods, it can interfere with other hormonal systems in the body, including those that control the menstrual cycle. Cortisol, the main stress hormone, can suppress the normal functioning of the hypothalamus. Remember, the hypothalamus is crucial for signaling the start of the menstrual cycle. When cortisol levels are high, the hypothalamus may reduce or alter the secretion of gonadotropin-releasing hormone, GnRH. This hormone is essential for triggering the pituitary gland to release luteinizing hormone, LH, and follicle-stimulating hormone, FSH, both of which are necessary for ovulation and the maintenance of a regular cycle. When this hormonal cascade is disrupted, ovulation may be delayed or skipped altogether, resulting in a late or missed period. This phenomenon is known as hypothalamic amenorrhea. It's a clear example of how the body prioritizes survival over reproduction when under stress. After all, from an evolutionary perspective, it might not be the best time to become pregnant if the body is already dealing with perceived threats. But what kinds of stress can affect your menstrual cycle? It's not just emotional stress, like anxiety about exams, work, or relationships. Physical stress, such as illness, excessive exercise, sudden weight loss, or even drastic changes in sleep patterns, can also disrupt hormonal balance. For many, a combination of these factors may contribute to a delayed period. It's important to note that a late period doesn't always mean stress is the culprit. Changes in routine, travel, dietary shifts, certain medications, or underlying health conditions like polycystic ovary syndrome, PCOS, or thyroid disorders can also affect your cycle. However, if you know you've been under a lot of stress lately and your period is late, it could very well be linked. How can you tell if stress is delaying your period? There's no definitive test, but keeping track of your cycle and any major life changes can help you identify patterns. If you notice that your period tends to be delayed during or after particularly stressful events, there's a good chance that stress is playing a role. So, what can you do about it? Managing stress is key. While it's impossible to eliminate stress completely, there are effective strategies to keep it under control. Mindfulness activities like meditation, deep breathing exercises, and yoga can help lower cortisol levels. Regular physical activity, without overdoing it, can also be beneficial. Ensuring you get enough sleep, eating a balanced diet, and finding healthy outlets for your emotions, such as talking to friends or journaling, can make a significant difference. Sometimes, just knowing that stress can affect your period can help reduce anxiety about a late cycle. However, if you experience prolonged or repeated disruptions to your menstrual cycle, it's important to consult a healthcare professional. Persistent irregularities could be a sign of an underlying medical condition that needs attention. For those who are trying to conceive, a delayed period due to stress can be especially frustrating. It's important to remember that while stress-induced changes to the cycle are usually temporary, chronic stress can have more lasting effects on fertility. Addressing stress proactively not only helps regulate your menstrual cycle, but also supports overall reproductive health. It's also worth noting that everyone's body is different. Some may notice their periods are very sensitive to stress, while others may experience little to no effect. Genetics, baseline hormone levels, and individual coping mechanisms all play a role in how stress manifests in the body. In some, stress can definitely delay your period, and it does so by interfering with the hormonal signals that regulate the menstrual cycle. The body's response to stress is meant to protect you, but in today's world, where stress can be chronic and pervasive, the side effects can sometimes be more disruptive than helpful. Understanding this connection empowers you to take steps to manage stress and maintain your health. If you find that your menstrual cycle is frequently irregular, consider keeping a journal of your cycle, your stress levels, and any major life changes. This information can be invaluable if you need to discuss your symptoms with a healthcare provider. Remember, while a single late period isn't usually a cause for concern, ongoing changes should always be evaluated by a professional. Ultimately, taking care of your mental and emotional well-being is just as important as caring for your physical health. If you're struggling with stress, know that you're not alone, and there are resources and support available to help you. By prioritizing self-care and seeking help when needed, you can support a healthy, regular menstrual cycle and overall wellness.